how do the test kits work? Is it a swab test? Is it a saliva or blood test? How do you test for coronavirus?
Well, the test for acute infection is a swab test. So a doctor or a nurse would use the swab, just like an extended cotton bud, and scrape the back of the throat and the nose, inside of the nose, and then that swab is sent off to the lab where we do something called a PCR test, a polymerase chain reaction test, looking for portions of the virus's DNA. And that test is reliable, and it will test whether someone's got the infection or not. That's how that test is done. It takes about 2 days to get the results usually. That's opposed to the antibody test, which we're currently trying to get a very reliable test for, which tests for your immune antibodies, which tend to rise 14 to 28 days after you've had an acute infection. And that's the one we're working on, because that will tell us who's immune, who's had the infection, and who's safe to go back to work with patients, so that the patients don't pick up the virus from them.
And the government have actually ordered millions of these tests that don't actually work, the antibody tests, is that right?
Well, we know that they're not 100% reliable. We know that some of them are better than others. However, we're trying to get a test which is very sensitive, in other words, that it finds out who actually has had the virus, and is also specific in that we know that it tells us who hasn't had the virus. So that's what we call an accuracy of a test. Now, most of these tests are acceptable if they're sort of 80%, 90% reliable, and we can always do the test a second time. But if they're only 50% reliable, they're probably no better, or they might be worse than having no tests, because we just can't rely on them. So we're trying to discover which tests are the best, and trying to refine them all the time. So we've got a reliable one, and that will be a game changer when we get one.
Now, question 5 is